Exactly.
Yeah, you on.
And go. Okay, so thank you, Dr. Michelle, for being here. We have Dr. Michelle with us today. I'm going to read a little bit of bio so that everybody listening to the podcast and watching the podcast can just get a feel for our beautiful guest today and who you are. Dr. Michelle Jorgensen, DDS, is an internationally recognized dentist, author, speaker, and leader in holistic and biologic dentistry. I want to ask about that. After a decade in traditional dentistry, a personal health crisis led to discover mercury poisoning from dental procedures, prompting a transformative shift in her career and the development of the whole body approach to oral health. She is the founder and owner of Total Care Dental and Wellness in Utah, where patients travel from across the United States to receive her integrative, is that how you say that word?
Yep.
Integrative health
Mm,
focused care.
yeah.
Dr. Jorgensen holds a DDS degree, is a board certified traditional neuropath, and her certifications in therapeutic nutrition and autoimmune nutrition. Ooh, she has authored multiple books, teachers, and mentors healthcare professionals nationwide, and campaigns. Uh, what's that? Companions, the connection between oral health and oral wellness. Excuse my
Mm.
reading abilities. Sometimes I get a little bit dyslexic. Welcome so much. Welcome, Dr. Michelle. So
Thank you.
nice
I'm
to have
excited
you
to
here.
talk with you today.
Yeah, you know what really, well, your energy right around all the time attracted me to you right away. And growing up with shamans, I read energy, and your energy was so amazing. The fact that you cared that deeply,
Mm.
that you're not just in one compartment, because we have a wholeness that usually does not get addressed, right?
Hmm.
Most people get out of the house with a head and a phone and disconnected. And when I said, no, the heart does this, the other one does that, because I can talk about that. I got more titles than a car dealership. I definitely, appreciate the education. So for me, the biggest problem in the planet is ignorance.
Mm. Hmm. Yeah, just
Yeah.
not knowing how our bodies work, not knowing how we can help them to be well. That's my biggest mission is just help more people be well. So glad to be able to share here.
Yeah, this is why I was like, wow, not only she writes and speaks and, so many modalities in the neuro-linguistic programming that, and you have them all. You have the visual, you got the kinetic, you got auditory, you got, the linear, all that. And would you talk a little bit about what propelled you? What was your drive to get to really have that such a broad
Yeah.
vision?
It certainly didn't start intentionally. I am a dentist and my father's a dentist. I actually have three brothers that are dentists. I mean, this is just what we do. So I thought that I would continue practicing just like he's doing. He's actually in his mid 70s. He's still practicing. He works in a
Oh,
prison of all things, doing dentistry there.
yeah.
And I thought that's just what would do, that I would just do it forever, just like him. And at about 10 years into practice, I started getting really sick. I didn't know what it was. And so I started doing what everybody does, right? I went to doctors, I got blood tests, I got x-rays, I started doing everything I could potentially do. And my big issues were gut health. I almost couldn't even drink water sometimes without pain.
Oh,
My
wow.
memory, I've always had a good memory, but I couldn't remember names from room to room. I couldn't complete sentences. Something was really wrong with my brain.
Mm.
But the big one that was really life changing was I just had this horrible fire numbness all the way down my hands. I couldn't hold anything. I couldn't blow dry my hair. I couldn't sleep at night. And I stopped being able to hold my dental instruments anymore.
Oh,
So it was so drastic. I put my practice up for sale and we didn't know what we were going to do. I had four young kids. My husband worked for the practice. So this was our entire livelihood.
yeah.
And it was all going up in smoke. So started just doing anything and everything I could potentially do. I'd started studying nutrition to try to heal my own gut. So I thought, well, maybe I can just teach other people nutrition and maybe I can work in a dental office and do that instead. And so I reached out to a dentist that had a nutritionist in his office, asked how it worked, and he said, well, back up here a little bit. Like your symptoms sound a lot like mine. Have you ever looked into mercury poisoning as a problem? And I said, well, no, I know that silver fillings have mercury in them. I mean, we all dentists are taught that in school. But I said, but I was taught they're completely safe and I don't have any fillings anyway. And he said, it's not the fillings you have. It's the fillings you've been drilling out for the last decade with no protection. You've been
Right.
breathing in all that mercury. And that was the first time that anyone had ever said that to me, that it could be a problem for anybody. And I said, well, I've been taught that they're completely safe. And he said, well, regardless of what you've been taught, maybe you should just get tested. I mean, what does it hurt to get tested? So I got tested, and that's what it was. Mercury toxicity
Oh
off the charts.
my
Yeah.
gosh.
Yep. So it made sense all of a sudden because mercury is a neurotoxin. Mercury fries your brain, it fries your nerves, it fries your gut, like all those things. So when I found it out, first I was relieved. Okay, I finally
Yeah.
have a thing I can work toward, but then I got a little furious.
Yeah, I
Like,
was like, weren't you
seriously?
angry? Yeah, right.
Why is no one talking about this? And there are so many other connections as well. I've struggled with infertility my entire life. We had to
Oh,
do, intervention to get two of our children, and then we adopted the other two because I was never able to get pregnant. And I'm thinking, how many women work inside of dentistry? It's the
wow.
large majority of the profession because dentists aside, every dental assistant, every dental hygienist, every receptionist, it's all women. Like, could mercury literally be affecting fertility rates? Could it be
Wow.
affecting gut function, brain function, all of the above? And the answer is yes. And I had never been told that this would happen. In fact, I'd been told if I talked to anybody about this, that mercury could affect their health, I would actually lose my license.
Yeah.
That's what
Yeah.
I'd been taught in school.
Hmm.
So when I learned this, I was like, what in the world? And it really made me start to question everything I'd been taught. Okay, well, if this big of a thing had never even been talked about and it made me deathly ill, what else was there inside of dentistry? And so I started researching and I started changing the way we were doing dentistry. And I thought all my patients would like go running and screaming away, okay, she's the crazy lady, don't go there
Yeah.
anymore. And actually the opposite started happening. People started saying things, well, if you're doing these safety measures, because I learned that there were things we could do to help make those removal appointments safe for both the patient and for me as a dentist. And so
Yeah.
I started doing them and they started noticing it was very different, from what they were used to. And they would say, well, what's going on here? Well, I've learned that mercury is really toxic and dangerous and it's released during this procedure. And they would usually say things like, well, I know you're doing this for you, but isn't this better for me too? Actually, yes, this is the only way you should do this. So patients started coming specifically because we were doing things differently. And then they
Yeah.
started asking questions like, well, what do you know about fluoride? Like, really, what do you know about fluoride? And what
Oh,
do you know about root canals? Like, really, what do you know about root canals? And I was still using fluoride and doing root canals. And I had to start researching, and I found that there was a lot that I didn't know, and I was smack dab in the middle of the profession. Like I said, dentistry was our life, and I had never heard any of this. And so I started learning the impact that dental health has on overall health, and it is immense. And there are so many things that no one's talking about that we need to talk about. So I changed my practice, and we started offering all of these other things. But at home, I still wasn't that well. I was trying to get rid of mercury myself. I was, all of these things. And
mm.
so I was
Well,
trying a bunch of things, learning, teaching myself and getting confused. What am I supposed to do?
Dr. Michelle, what were you doing to try and eradicate the mercury?
Elation?
It's
Did
really
you
hard. Yes, I
elation?
basically they told me, okay, you need 97 chelation IV chelations, and they're an hour and a half each. I said, well, I can't
Yeah.
do that. Like I have four kids in a busy practice that's like suffering over here because I'm so sick.
Right.
And
Right.
so I started having to do very slow chelation with cilantro and chlorella
Dry
and,
cilantro.
herbal things that actually are binders in the
Yeah.
body. And the big one is I had to stop putting it in. So I had to start using these precautions where I was using a special mercury filtration mask and so as I started doing these things at home, patients would ask me, "What are you doing at home? Like what are you doing for your health and what are you eating?" And I really thought that the two things were separate. Like this was my home life and this was my work life.
Mm-hmm.
And I realized actually no. they're the same. And that's where living well with Dr. Michelle came to be, is because it's living. What am I doing at home? We live in a homestead. I garden. I, can my own food, and I love to cook and cook natural food. And I was like, well, why am I not sharing this with the world too? Showing them how I'm living and how that can influence their living. So that's really the origin story of all of it, of the dental practice and how it evolved to what I call, health-based dentistry, and then how I brought all of these pieces about how you can live a life to stay well. You don't have to get sick first, and how that
Right,
integrated with it too, because it really
right.
just came from my own experiences.
That's fantastic. I'm a survivor of this. Oh, she's gonna snitch. I survived Hashkin stage 4. They wouldn't treat me.
Oh,
And the people that helped me, well, one of them was, Dr. Misho Kushi, a scientist that convert me into macrobiotic because
oh,
every illness, or inflammation or whatever loves acid. And the
yes.
macrobiotic is very alkaline.
Hmm.
And so, all in all, I learned about right away the metals to, get the metals. And I make this sauce that I use all the time with cilantro, parsley, to be able to increase the release,
Yeah.
olive oil, and Celtic salt. And I
Oh,
just put it on stuff.
sounds like a chimichurri sauce. That sounds delicious.
Right.
All
But,
right.
but it's a binder. It's a binder,
Uh-huh. And
And,
it's
and
interesting when you talk about things like that, people have been eating that sauce that you just described for a long time, but not ever saying, oh, this is great for the toxins that are actually in the food we're putting it on. Or this
yeah,
keeps us safer. Some of those antimicrobial actions in the garlic that you've added actually keeps you safer from the meat that you might. So it's so interesting when we look back at ancient traditions and the way people have been eating and doing things forever. All of a sudden, science is now telling us why it worked, and we've forgotten
yeah.
all this piece, all this information. I love what you're doing.
Amazing. Yeah, I'm glad that, I'm in Cornell doing medical plans right now, which is really overwhelming. But I'm glad to see that they kind of going that route somewhat. That they are studying plans, that they are, trying to shift somewhat why we can replace the med with something that you can use at home, you can resource at home.
Yep.
It's lovely. I'm glad with that. Now, the fluoride, which is so much, I just had my water analyzed and it was some little bit of fluoride again, and it's put in the water, in the
Yes.
drinking water
Yes.
for
Absolutely.
everybody. And
Yes.
can you tell us a little bit about the fluoride?
Yeah.
Yes. So the idea of fluoride is great. Well, they actually found it in the 1940s that areas that had higher levels of fluoride naturally, so this is well water, people who had well water that just had higher levels of fluoride, they were getting less tooth decay. And so they looked at it and they said, this is great. Like, we can prevent cavities if we just
Mm.
add fluoride to water or fluoride to toothpaste or fluoride to mouthwash or whatever it might be, because fluoride does make a tooth less resistant to acid. That's really what it causes a cavity is acid gets on the tooth, it dissolves the minerals, leaves a hole, and bacteria crawl in. So if you can make a tooth less resistant to acid, to the minerals dissolving, then it will slow down tooth decay. So the idea was awesome. So they started adding it to everything. The problem is anything that we put in our bodies, it has an intended effect, right? So the intended effect was stop tooth decay, harden our teeth. It did
Mhm.
that.
Mhm.
But everything we put in our body also has unintended effects. We call them
Mhm.
side effects, but really all it is that everything is going to affect every single cell. No matter whether we wanted it to or not, it's going to because we put it in our bodies. So fluoride has a couple of unintended effects. The first is that it changes the structure of bone as well. So teeth are made of something called hydroxyapatite. It's a mineral complex. So are bones. So if it's changing the structure of your tooth, it's also changing the structure of your bones. It's making them harder and more brittle.
Mm.
Do we think that that could be a problem for bone?
Yeah, just a little bit,
A
right?
brittle bone is not a good thing. So it changes the density of bone. Second thing it does is it's very similar to iodine. They're kind of cousins. They're very similar structure, fluoride and iodine. Iodine is needed, first of all, to activate thyroid hormone. but it's
Mm.
also needed to activate every single cell that secretes something. So that's stomach acid cells, that's all of our hormone cells, all of those things require iodine to work like they should. Well, fluoride is a bully. It bullies out iodine and binds in the place that the iodine should. So now you can get a blood test and it'll say, no, you have plenty of thyroid hormone, but the thyroid hormone has been bound by fluoride instead of iodine. So it's not active. It's not
Mm.
usable. We can't use it. So now we have a massive increase in people who have low thyroid function.
Yeah.
And you probably hear about this all the time.
Yeah.
In the 1970s, they used to use fluoride to treat people who had hyperactive thyroids. They've known it for decades that it decreases thyroid function. So now we're putting it in everybody's water? Okay. So that's problem number two. Problem number three is that it affects brain development. Literally, there was a study January of 2025 that showed that higher levels of fluoride led to lower levels of IQ, especially in
Mm.
boy children and male children. So
Oh,
for
Mm.
me, the question I have is, okay, so its intended consequence was to stop tooth decay. So did it work? Has anyone had a cavity since 1940?
yes.
Dentistry would not be in existence if it had done its job. So, first of all, it didn't do its job. It didn't stop cavities, but it also affects all these other cells in a negative way. So, was it worth it?
Mm,
I mean, to me, this is such a no-brainer. Like, why do we even need to talk about this anymore? Especially
Right.
because cavities aren't a deficiency of fluoride. Remember, we talked about it. Cavity is when
Yeah.
minerals are pulled out of the tooth. So we put fluoride in, it makes it stronger so it can't get pulled out as much, but it's not completely effective. I mean, people still get cavities. So instead of putting fluoride in the tooth, why don't we just put more minerals in the tooth? So
mhm.
now we can put back exactly the mineral that was lost. It's called hydroxyapatite. So we have
Right.
hydroxyapatite products. That's why I started my product line because I
Yeah.
Yeah.
said, all right, we need to have product that actually does the job, prevents and even heals cavities without all of these unintended side effects. Because hydroxyapatite in the body knows what it is and it loves it. It's what makes up bones. It's what makes up teeth. But when it hits stomach acid, so if you swallow any of this, toothpaste, tooth powder, any of these things, it actually just breaks apart in the stomach into calcium, phosphate, all things that the body knows how to use. So there are no unintended effects of hydroxyapatite.
That's
It's simply
awesome.
what your body wants. So to
Mm,
Yeah.
me, why would we ever use fluoride again? And the other problem, talking about water, now we're dosing everybody with the same amount of medicine, basically. So I joke about this. I say, okay, let's say that there's just too many people that are depressed in the world. So the government decides, well, let's put an antidepressant in the water, right? This is going to be awesome. Let's fix it for everybody. But what if, first of all, I don't need an antidepressant? So now I
Right.
have something I don't need. Or second, I'm already taking one, and now you've just double dosed me. And third, my children's taking the same dose as I am. That's not appropriate. It's an undosed
mm-mm,
medication.
mm-mm.
It makes no sense that
Why
we're
does it
Yeah.
why
we're
does it
doing this to
affect
everybody.
men? Why does it affect boys more?
Because
Isn't that interesting?
yeah, that's what happened. Now I had more compassion for them a little bit.
We do not need the men in this world to be dumb. We have to,
Oh,
that
nobody to be dumb. Like that's
No.
no, but
Oh, yeah, exactly right. So it's one of those things that frustrates me so much because I get so much backlash from the dentists. In fact, it's interesting. I live in Utah, and Utah is the first state that banned fluoride, which good for you, Utah. But
Yeah.
there were so many emails that I got from the American Dental Association that they sent to every dentist, in the state and said, please go talk to your legislators, tell them this is
Right.
a terrible idea. There's going to be so much more tooth decay. I'm like, what are you freaking talking about? Have any of you read a research study in the last 2 decades? Have
Right.
any of you actually looked at the effectiveness of this and what we can do instead? Has anybody actually made sense of this? No,
Right.
we're all just parroting back what we've heard forever. We learned it in dental school 30 years ago, and so it must still be true today. So I get
Yeah.
so many arrows in my back talking about fluoride, and I'm like, you know what? Let's talk educatedly. You come to me with your research, I'll come to you with my research. We'll put them
Right.
side by side and see what makes sense for us. And
Right.
nobody wants to do that.
Well, the
Mhm.
They just want to
problem
say you're
is,
crazy.
you know what? That's fine because they don't know what crazy is actually. But being that I'm a hypnotherapist and a cheese therapist and all that, you know what? uh, people don't like to be out of the comfort zone. It's too scary.
Yep.
It's something that is known.
Yep.
And so if the world likes to live in comfort, the brain likes to be in comfort.
Yeah.
Doesn't like uncomfort, new, doesn't like that.
I
So with
remember.
that being said, look, imagine what they said about Einstein and imagine what they say about all that. And he said it very clear. So you can't fix a problem with the same mind that created it.
Hmm.
I like
And
that.
there you have it.
I
I
like
remember
that.
Boom.
being totally shamed when I stopped them using fluoride on my kids at the dentist when they were tiny. My kids are in the 20s now, but I was
Exactly
like a
right.
long time ago, I was like, no, we don't need any fluoride treatments. And they were like, well, we cannot be held responsible for the state of what your children's teeth are going
Uh-huh.
to turn out like.
Yeah.
I'm like,
The
well,
rapid
I'm
dental
willing to
decline.
I'm
Yeah.
I'm I'm willing to risk that, I'd rather their brains be in a good place than
Yeah.
yeah.
I'm gonna send you a dentist that is a trip. He's Chinese, and I landed through self-realization fellowship through a yogi, and he does. It's called pinhole therapy for
Yep.
gums.
Yep. I know pinhole
Yeah,
therapy. Yep.
Dr. Chow.
Yep.
And he did 23 of mine.
Wow.
My teeth, some parts you can see the bone,
Wow.
the jawbone, not to mention I was losing bone.
Yeah.
And he did 23. I look like some sort of monster for
I can only
like three.
imagine.
Oh, I had no eyes, so like so swollen. And my lips were like, this is what I look like. Oh my God. I had to sleep standing up because you bleed a lot, sitting up. And he said, I don't want you to choke in your blood. I was
Oh
like, oh,
gosh.
this is good. Yeah. But amazing. My gums are like brand new and he doesn't cut.
Yeah.
In any case, the syndrome of fear right now and the clenching on the teeth and how it destroys the bone and the gum.
Yep.
It's a big deal for the gum, right?
Yep. Yep.
And what do you, because I know you have a video on that about the clenching of that. I've
Yep.
seen all of the videos, by the way.
Yes, it's really actually interesting. And I didn't know this for years either. So we don't know everything as practitioners. And I think it really
Free.
requires us to keep asking questions and keep being curious. And that's really, I think, where the fault lies inside of the profession is if we stop asking questions and we stop saying maybe we weren't right about that. And it's
Mm.
okay to say that. And it's okay to say there's something better now and research supports it and let's go there. And so this is one of those things. Clenching, the only thing I was taught to do in dental school for clenching is to give you a night guard. So now
Mhm.
when you clench, at least you don't destroy your teeth. You can just chew through the plastic instead.
Right.
Mhm.
But I was never taught why people clench. Like, could we do something about that? Imagine that.
Mm.
Let's do that because not only do you clench during the nighttime, but you do it during the daytime.
Mm.
Right.
So unless you're wearing a piece of plastic around all day long, it's not really going to slow down the gum loss, gum recession or any of the above. So as I've really studied, I found that there is an underlying issue that no one or very few people are actually talking about. So let's talk about nighttime first. When you lay down, first of all, gravity, right? Gravity, this is why they told you after your surgery to sleep standing up because you needed to work with gravity after surgery. So when we lay down, gravity is going to let everything that's in our mouths fall backward, correct?
Right.
In deep sleep, so we go through different sleep cycles all night long. We go through about 90-minute cycles. So we go light sleep, deep sleep, REM sleep, light sleep, deep sleep, REM sleep. So in deep and REM sleep, especially REM sleep, our muscles paralyze, like we stop moving, which means the muscles that hold open your ability to get enough air also paralyze. So
Mm.
if you already have too little room up in here, up in this mouth, and your tissue falls back, and the muscles paralyze so they relax. If you can't breathe when that happens, your body will wake you up and you
Mm.
will squeeze your teeth. You will clench your teeth because when you clench your teeth, it tightens up all these muscles and now you breathe again. So anytime I see somebody that's clenching at nighttime, guaranteed you are not getting enough air when you are sleeping. So then we
Mm.
go, okay, now we have something to work on. So is this that the mouth is too small? I liken it to like a garage in a car. You've got a great big huge wide SUV and you got this teeny tiny garage. So you're bumping the sides, you can't fit in the front, the back's hanging out the back, and you can't breathe by it anymore. So we have to make the garage bigger. So we expand mouths even in adults and we make room for the tongue and the teeth and everything to be forward. So when you lay down, there's still plenty of room to breathe past it. Sometimes we have to
Mm,
shrink up that tissue so that when you lay down, it doesn't fall back anymore. It's up and out
mm,
of the way so you can breathe the right way again. Sometimes we have to
mm.
train your tongue what to do. Hey, your tongue needs to come up and forward, not down and back. Sometimes it's tied under here and it actually
Yeah.
can't do the job.
Mm,
So we have to actually retrain it and clip it so it can do that.
mm,
So the key
mm,
is figuring out, okay, clenching. And people will say, well, I only clench when I sleep, when I work out, when I focus. Like, what do all those things have in common? They need more oxygen. Sleeping,
Mm,
working out, focusing, you need oxygen. So it's all about getting you enough oxygen, which stops
mm,
the clenching. This is something I
mm.
didn't know until about 5 years ago.
Yeah. You know about mewing?
Uh-huh. Uh-huh. Oh yeah,
Oh,
that's some of that retraining. That retraining where the tongue should go, how it
yeah.
should go forward, getting it up and out of the airway. But then along with mewing, you have to make sure that the tissue, there's not too much excess tissue down here. We might have to shrink it up a little with some lasers, or we may just have to make more space for it somewhere in the front of the mouth.
Ah, okay. Yeah, because I tried the mewing a lot. Another thing was that you talked about before, it's about dryness at night, right?
Yep. So often, if there's not enough space for the air to get past when you're laying down, one of the things the body will do automatically, it'll do a couple of things. You'll squeeze your teeth because it tightens up the muscles. But again, as soon as you do that, it takes you out of deep sleep. So now
mm,
you wake up in the morning, you're like, I slept, but I swear I didn't. Like I don't
mm,
feel rested at all. And your bed looks like a tornado hit it. You're tossing and turning all night. You're up, you're looking at the clock, you're going to the bathroom, you're doing, that's not rest. You're not actually getting down into that restorative phase of sleep that the body recharges and regenerates and all those kinds of things. So, that's the first problem is that you're not getting the air that you need, all night long and you're not feeling good. So we have to be able to, figure out what do we do to get that air daytime and nighttime. And the first thing the body does is squeezes, tightens up the muscles. The second thing it does is it drops your mouth open. Why? It can now get the air past the tongue, the tissue, everything else. So you wake up and your mouth feels like a desert. What in the world?
Mm,
It's just simply trying to keep you alive.
mm,
mm,
So mouth taping helps, like it keeps the lips together, but it doesn't necessarily fix the problem if this is all blocked back here. Does that make sense?
mm. Yes.
CPAPs are something that people get all the time too. They go and they find out that they have sleep apnea, so they're given a CPAP. CPAP is nothing more than a band-aid. All it's doing is forcing more air down the nose usually. But if this is all blocked, it's kind of like if you have a clogged kitchen sink and you just try to put more water in. Like, what is it doing? It's not going anywhere. It's just going
Mm,
back up. And the same thing people say, my CPAP blows off my face and it dries my eyes out so bad. I'm like, it's because the pipe is blocked. We got to
mm,
unblock the pipe, and then the air
mm,
can go where it's supposed to go. So all of these things, dry mouth is a sign that you're not getting enough air at night. Clenching is a sign you're not getting enough air at night. Wearing your teeth off in the front right here
um,
is a sign you're not getting enough air at night because you bring your bottom jaw forward in an attempt to make more space back here. All of these are signs you're not getting enough air at night.
I
oh,
love the amount of research because I'm a research freak. Corey
Me
can tell
too.
you.
Uh-huh.
I'm always on research mode. And the fact that I gotta give it to you that you're such a peaceful warrior because you're still a warrior. And the system is brutal, especially I feel more with women. So that
Yeah.
you have survived that. It's like
I
damn,
just have to
because
not care. It's like
yeah.
suck the hand, you know what I mean? I just don't
Oh
care. I
yeah.
don't read comments. I just don't.
Yeah, me too. I'm like, whatever,
Yep.
you got your thing. Uh, Sorry that, you're going that route because I know it doesn't work, but it's your life, you know? Yeah, so you let them go, but and that you care about the animals too, if you can, oh my gosh, that you're coming up with products. I know it was almost $12,000 something to be done in my little dog's mouth because
Uh-huh.
little dogs have issues with teeth.
Uh-huh.
And You know, thank God she had insurance, but it didn't solve anything. If the cause is there, it doesn't matter what they do to them. Now they put them under anesthesia, whatever. If you don't solve the cause,
Yep,
why put them through that, you know? Like, why do
exactly.
you put them through that? I really, because it's such a big thing, the clench, with all the stress that people are going. And also, if you can talk a little bit about brushing, because I know most people want to brush right after they eat.
Yeah, that's a problem. So again, let's go back to how cavities are formed. When we put food in our mouths, whether it's acidic or not, our mouth is going to increase in acidity because that's the first stage of digestion. So that just starts to break food down. So every single time we eat, our mouth gets more acidic. Well, when there's acid that is in contact with minerals, it will dissolve minerals. There's, old things you could do where you pour a Coke over a quarter, or over your battery terminals on your car and it eats all the minerals away. So acid will dissolve minerals. So acid will increase in your mouth every time you eat. It will also increase if you add acidic foods. So if you're constantly drinking things like sodas or energy drinks or even coffee, you can increase acidity in the mouth. And you're just constantly doing it, sipping a little, sipping a little, sipping a little. Even lemon water. People will say, well, lemon water is great. Well, it is, but it's also a pH of 2.2, which is the same acidity as battery acid. So you have to understand what it physically does to the teeth on its
Mm,
way down to wherever you're putting it, right? It's
Right.
going to make those teeth soft.
I
That
know. I
acid is
used to
going to
eat them.
dissolve the minerals. It literally is going to start eating away the tooth. So then if you go and brush right after eating anything, because remember, any food is going to increase the acidity in the mouth, but especially acidic foods or throwing up, that is the worst time to brush your teeth because your
Ooh.
teeth are soft. So now you go in and you brush because you want to get rid of that taste and it tastes terrible, whatever. You are literally brushing your teeth away.
Oh, wow.
So the rule of thumb is you should not brush within 30 minutes of eating until after 30 minutes of eating. So I start every single morning with a glass of lemon water with salt in it, which is fabulous. The lemon water brings vitamin C. It basically wakes up your cells. I do it with warm water, which wakes up my digestion. The salt is electrolytes, which help the vitamin C get to where it needs to go. Like it's the best thing to do. But the worst thing to do is go drink your lemon water and then go right in and brush your teeth because that lemon water is just going to make your teeth soft and you're going to
Yeah.
brush them away. So I wake up, the very first thing I do is go brush my teeth. First thing. Like I don't do anything. I go to
I
the
learned
bathroom
that
and then
from
brush my
you.
teeth. Good.
I
I'm
learned that
glad.
from you.
I'm
That's what
glad.
I do.
Yep.
Yeah.
Yep. Go
Yeah,
brush your
boom.
teeth and then go
Yeah.
drink your lemon water. And then it doesn't matter. You
Yeah.
can drink your lemon water 2 minutes later. It doesn't matter because you're not going to be brushing your teeth after once they're soft. So that's
Yeah.
the key piece.
Genius,
Yeah.
guys, everybody listening. So, first thing in the morning, you brush before you
Yeah.
have your breakfast or you drink your
Yeah.
coffee or anything else. Always
And
brush
don't
first.
brush after.
Don't
Yep.
brush after. Most
Yep.
people brush after, though, don't they?
Because they think, well, I want to brush off what I just put on.
Yeah, exactly. Yeah.
Well, if you're going to do that, you need to wait like a good half an hour to even an hour after you ate to be able to do that. Even, people who walk around, they brush after lunch. It's the worst time to do
Yeah.
it. Rinse, rinse, rinse is great. Use some water, swish it around, rinse, spit it out. That's great. Or like I have some, I don't know if I have one right here, hydroxyapatite mints. So if you
Mm.
want a freshening and you pop a
Yeah.
mint, it has the hydroxy, so it has the minerals in it. So it's just going
I
to
have
replenish,
it everywhere.
restock the mint. Yep.
I have them everywhere, but somebody came and I said, "This like what is that?" And I said, "The best thing. I have a habit of giving away things, so I gave them. And you know me, Corey. I gave them mints, and I'm like, oh great. So I have another stash of your mints, though, that I carry everywhere.
Every
They're
time she
good, aren't
buys
they?
something, she has to buy 10 of something because she always gives everything away.
You know what I learned my mother, she didn't know. Well, I grew up in Peruvian Andes,
Mm,
never saw a store, no shoes, never saw money until I was
wow.
13. So it was not like that conscious of, but I have never had a Coca-Cola in my life. I
Oh,
never had and not a soft
so good.
drink thing. It seemed weird to me, this concoction that it was, and I don't know where that come from. I'm a water person, but the fact that they think that brushing prevents cavity, and you have a video that you relate that relationship of what cavities can be caused from and all that. Interesting. And also my mother always said the antibiotic will not help an infection, but I never knew why, but you explained that.
Yep, yep. So yeah, toothbrushing, it's great. Like you need to brush your teeth at the right time. Obviously, you need to get food debris and bacteria and plaque off of your teeth. And that does lead to tooth decay. Like if you are not brushing your teeth and those bacteria are living, I like to call it like they're building condos. If they're building condos on the teeth and they're having parties, they love to eat sugar. That's actually what causes a cavity. Either acid itself or the bacteria in your mouth eat sugar and they excrete acid. So it's still acid, but it's either bacteria that have eaten sugar that create acid. So it's not sugar. Sugar doesn't lead to cavities. Isn't that
It's
interesting?
the acid that's
It's
produced from the sugar.
correct. Yep.
Wow.
Bacteria
Okay.
eat the sugar and then excrete acid, and that's what causes the cavity. So the longer the bacteria sit on the teeth, the more likely they are going to create acid. So we gotta get the bacteria. We gotta break up the parties every day. We gotta break up the parties. No more parties. No more bug parties on our teeth. So that's number one. But the other one, and this is an interesting one, especially for women, because I'll hear stories all the time. I'll hear, young girl comes in, she has 17 cavities. She's like 16 years old. She has
Ooh.
a mouthful, and mom's devastated, daughter's devastated. She literally has not done anything different. She hasn't changed her diet. She hasn't changed her brushing. Like, what just happened? Or moms. I just had my baby and I ended up with three teeth that are now dying, and somebody told me I need root canals on them. What just happened? Like, why? Well, the other reason is the body has to be in kind of balance all the time. And there's a huge demand in the body for minerals. Minerals run pretty much every single system that works in the body, especially our brain, especially our heart. And it's minerals carry things into the cells. So they're really like the DoorDash of our bodies, they're bringing things wherever we need to go. And if we don't have minerals, then those jobs don't work. Well, think about puberty. What's happening in the body? Body's growing massively, using a bunch of minerals,
Okay.
right? To build bones, to build all these things. So if there are not enough to go around, well, what does the body do? Like it has to keep running your heart and your brain, so it has to pick and choose. All right, well,
Yeah.
you can live without your teeth, so I'm going to pull minerals from that to go take care of your heart and your brain. How about
Yeah.
pregnancy? You're
Yeah. We
literally
lose our
growing a baby.
hair and
Yeah,
everything,
yeah,
right? Yeah.
yeah. So it's
Mhm.
all about the minerals. You have to have minerals on the outside so that they're not, so that you can restock them as soon as they are pulled out from the acid. And you have to have minerals on the inside so there's plenty for all of the body to use so it doesn't pull from the teeth. So those are really the two sources of tooth decay are minerals on the outside, minerals on the inside. And if you can tackle both of those, so we have product for the outside to add minerals, we have product for the inside to add minerals. If you can do those two things, you don't get cavities. Like you literally do not get cavities.
Even
Mhm.
a specific one, because I know boron is really a good friend of a bone or a combination, because things work in a synergy, not one thing
Correct.
that's right.
Yep. So we have a
That's
calcium, magnesium, zinc, and copper are the ones that are in our tooth and bone formula. So,
fantastic.
yep, yep. It just helps to replenish the body so that there's enough around for all of the things that the body has to do.
Fantastic. And
Mhm.
I thought that the fact that the antibiotic wouldn't really work in an infection was because it wasn't that much blood supplied to places.
Let's
You
talk
had
about that
another
one.
explanation too, which is genius.
Yep, yep. So really, it's a matter of what infection are you talking about? If you have like a big old infected gash on your arm, an antibiotic is going to help, because it's going to be able to get there. But in the mouth, the most common infections are actually underneath old root canals
Mm.
and in areas where teeth were removed that didn't heal properly. So I'm talking wisdom teeth, and a lot of people had their wisdom teeth removed, but other areas too. Well, both of those areas are actually dead. When you've had a root canal, what happens is we remove the nerve, we remove the blood vessels, all the blood vessels inside of the tooth. We take it all out. I don't do them anymore, obviously, but when a root canal is done, disinfect it and fill up the tooth with this plastic stuff. Well, the tooth's dead. It's no longer alive. So if it's no longer alive, there's no way that an antibiotic that you've taken in your gut is going to get to the inside of the tooth. There's no more blood flow. Remember, it's full of rubber now. There's no way it can get there. So
Mm.
it can't take care of it. Even if it starts to kind of kill any infection that's growing around the end of an old root canal because there's still dead stuff. The bugs are still finding it. It might take care of that infection locally right then, but 10 days later, it's back again because the dead stuff's still there. So I joke all the time and say, let's say you've had a gallbladder attack and like you just, oh, it kills me whenever I eat anything fatty. You go to the doctor, they say, let's take your gallbladder out. So they take it out. They clean out the inside of it. They remove all the blood vessels, everything. They fill it up with some rubber stuff and they put it back in you.
Mm.
They don't do that. Why do they not do that?
Mm.
Because it's a dead organ
Yeah.
and that doesn't work. Like bacteria find it, it's going to get infected. Well, these
Yeah.
are dead organs. When you've had a root canal tooth, it's a dead organ. There's no more
Mm.
blood flow. The antibiotic can't help you. It's going to reinfect constantly. And the same where a tooth is removed. There's a dead zone if that didn't heal right. And there's no way to get an antibiotic there because there's no more blood flow.
So what's your procedure now with that? You say you don't do them anymore.
Yep.
What was your discovery with that?
It's huge. And the reason I don't do them, I'll always remember this patient. She'd had a root canal previously and she came in for a cleaning and she said, this tooth, I don't know, it's just never felt right since that root canal. And people don't say it hurts. I mean, remember the nerve's gone, so it doesn't hurt anymore. So they just usually say, I don't know, just maybe it doesn't feel right. I can't really tell. So I took a regular dental x-ray, the kind they put in your mouth, take an x-ray, and I said, it looks fine. Like there's
Mm.
nothing wrong with that root canal. It looks just great. But I
Mm.
had just gotten a new machine called a cone beam CT scan. So cone beam CT scan, or CBCT is what it's abbreviated as.
Mm.
Just gotten a new machine. I said, let's go take a picture. Just, I don't know, just for the heck of it. Let's go see. We went and took a scan. And it's not like the kind you lay down in the doctor's office. This is the kind that just goes around your head, but it's a specific 3-dimensional scan. She had a quarter size hole eaten away in the jawbone above the end of her root canal tooth, and I couldn't see it. I could not see it on the regular dental x-ray. It is not visible unless you get a 3-dimensional scan. We both saw it and went, oh my gosh, that tooth's coming out tomorrow. She's like, could that be like why? Like, she was a big tennis player. She's like, could that be why I'm always getting this inflammation in my joints and like it hurts all the time? I'm like, yeah, your body's fighting a massive infection. We had no idea it was even happening. So now that I take these 3-dimensional scans and more dentists are doing this, we are seeing massive failures and root canals, massive infections around old root canals that we simply couldn't see. So, what do we do
Yeah.
instead? My goal is to never have a person go to the point of a root canal. So, if a tooth is still alive, and the way you can tell if it's still alive is if it's still sensitive. So, if
Mm.
you put something cold on your tooth and it's like, oh my gosh, that is so cold, it's still alive. Good news. That's awesome. That's great news. What we do is we remove the cavity as deep as we can go without actually getting to the nerve. We leave the nerve alone. So we remove the cavity as deep as we can go, leave the nerve alone, and then we use ozone right there. Ozone's incredible. It kills any bugs on contact. So we use
Mm.
ozone gas right against that layer. It kills all the rest of the bacteria without us having to disrupt the nerve. And then we
Mm.
just fill over top of it. So we keep the tooth alive.
That's awesome.
And we have about a 95% success rate of keeping teeth alive that people said, you need a root canal. And they come here and they say, do I need a root canal? We're like, heavens no. Let's keep this baby alive. But if it's already dead, if you have swelling, if you have pus coming out of your gums, like if you can't bite on your tooth, it's just killing you, the tooth's already gone. So at
Yeah.
that point, the only choice is either a root canal or we remove the tooth and replace it with a ceramic dental implant. So
Mm.
if somebody's already had a root canal, that's their option. They leave it alone and they hope that that infection isn't spreading somewhere else in their body. I have yet to find somebody who has or had cancer that doesn't have an infection in their mouth. Haven't found one yet.
That's
So
crazy.
these are the kinds of things, these low dose chronic infections in the mouth, they impact the immune system in a way that the immune system can't take care of you elsewhere. So it's not that the root canal causes cancer, it's that the root canal depresses your immune function enough that your body can't keep the cancer at bay. Because every single day we have cancerous cells develop, every single day, because our cells recreate itself all day long. And sometimes they just do it in the wrong way. And that's what we call cancer. But your immune system goes, gotcha, and kills that cell. And then it doesn't spread. But if the immune system is distracted, it's taking care of other things, it's doing all this, infection over here, this root canal, then these cells divide. There's not enough guys to go over there and kill those cells, and then the cells start to replicate, and that's what we call cancer. So we have to give our bodies the ability to keep themselves well, and these dental infections are one of the biggest components in our bodies not being able to do that.
Wow.
So we remove teeth and we replace them with ceramic dental implants. That's what we do.
You're muted, Isabel, for some reason, my love. Did
I
you try?
have
There
because
you go.
well, my bigger dog was bullying the little one. So the I have ozonated and I've been insufflating whatever so many years. I will say 50, 60. Anyway, and also I have a hyperbaric chamber at the house.
Wow, nice.
It's a medical hyperbaric chamber, that, no, the soft, the hard, I think all these things that help. And I'm so glad that you spoke about this because I have something going on in one tooth that supposedly had like three different, root canals. Why? I mean, either
Yep.
you do one, why three or four, and yeah,
I
and
think
they
that
put a
one
cap.
probably needs to
Uh,
come out and be replaced.
that needs to go bye bye,
Yep.
go
Yep.
back to God or something.
Exactly.
But yeah, and what would you say for people that they can create a nice system for themselves, because people don't do things if they don't know what to do.
Exactly right.
Exactly.
So it's understanding what keeps our mouths well. It's keeping
Mm,
those bacteria from having parties. That's number one. So we have to brush. We have to restock our teeth with minerals. So that's
mhm,
using hydroxyapatite. And we actually have a prebiotic. This is what we're putting in the pet product as well. A prebiotic in our toothpaste and our mouthwash that actually prevents bacteria from making parties at all. Like it doesn't let them stick together. So that helps with gum disease because gum disease is huge. Not only for pets, it's actually one of the number one killers in all animals is gum disease. And you talked about the expense of that with so expensive and the worry about putting them under anesthesia. Same thing goes for people. About 60 to 80% of adults have some form of gum disease. You can absolutely keep this at bay. All it is
Yeah,
keeping the bugs off, keeping the parties from forming, and using this prebiotic to keep them from sticking together. So there are absolutely ways to prevent it, and it's not that difficult. You then add minerals on the inside, minerals and vitamin D and K, vitamin D3 and K2. The reason for those is you take minerals, the vitamin D3 grabs them, and the
right,
vitamin K2 puts it in the cell. So
right.
you do those two things, hydroxyapatite and prebiotics on the outside, minerals and vitamins on the inside, you don't have cavities. You don't
Yeah,
mhm.
and
have
I
teeth
love that
decaying.
you have it combined already, that you have it so people
Yep.
don't want to, oh God, I'm going to have to buy 30. My husband
Nope.
is like, he started like that. Now he's got an ocean of stuff that I pendulum and I test them and he better take it. Oh, no, no, better take it. I said, because if you don't, this is not going to be nice. So you want her nice. And he's very, very consistent now to do it, but she's got it, all the formula. We will share all your products, we
Yeah.
will share the books. And the fact that, what would you say to them when they want to interview a dentist? And right,
Good
right,
question.
because people are afraid of authority and going, well, I don't know enough to be able to,
Mm.
one would be to buy your books for
Got,
one.
got so many root canals because didn't know any better, I don't, oh,
Yep.
okay,
Yep. So right now you need a cone beam CT scan.
Yeah,
So the
exactly.
first the first starting point is finding a dentist, just like you said, Isabel. So that I actually have a directory on my website. So if you go to
Ah, perfect.
livingwellwithdrmichelle.com, you're going to
Yeah,
find a directory on my website of
yeah,
like-minded dentists who can provide this kind of care. But if
yeah,
there's nobody near you, some of the questions you're going to ask is, do you have a cone beam CT machine? That's the first thing. And cone is CONE because that's kind of a weird word. Beam, BEAM. Cone beam. It's basically the shape of the beam, the X-ray
yeah,
beam that we're using. So cone beam CT machine. Do you have one of those? That's going to be
yeah,
first question. Number
yeah.
two is what's your stance on fluoride? If they say,
Mhm.
oh, we give you fluoride treatments every time, you go, oh, thank you very
Right,
much. Okay, click,
right,
click. You know what I mean? Because you know that
right,
now they're not looking at current research. They're not
right.
looking at the way things really work. The third one is what
Yeah.
is your stance on root canals? If they
Yeah.
say, well, oh yeah, we do root canals every day. Okay, great. Not the place for me then. I want somebody who's really looking at the research and saying, is this actually the best option for somebody? And
Mm.
what can we do instead? So those are
Right.
three biggies that I would ask. Cone beam
Yeah.
CT scan, fluoride, and root canals. What's your
Dr.
stance?
Chow uses it. It's freaky because you see your whole skull.
That's the cone beam CT scan. That's what I'm
And
talking
it's like
about.
the he
Yep.
goes, that's your, you, that's it. I was like, you kidding me? It was freaky. There is your skull going around
Uh-huh.
like in some sort of,
Yep.
Star Wars
Yep.
machine.
That's what
And
I'm
then
talking about.
he does a sonogram though, too.
Nice. So he can see if there's calcifications or anything else.
Yeah, he
Nice.
does sonogram, he does all these things, and he's got all this system to take photos and every kind of thing of the because when he
Yep.
finished doing this, that I started at 8 in the morning and it was 5 in the afternoon.
Oh, yeah.
Okay. For one, I had so much PTSD with my head because I had a lot of beatings growing up and
Oh,
all that. So for me to, and then I am a cranial, 5 level craniosacral.
ah,
To have that mouth open that
oh,
long
like that.
and
Yeah.
all that, I was like, okay. And he wanted to do more pictures, and no, I'm out of here. And I got up and I left. I'm
You can
like,
do them later.
no more.
Exactly. And really what you're saying is so key. You have to be an advocate for yourself. And this whole, not feeling like you can stand up to authority, all those kinds of things. What I recommend to people, and this is coming from a place of experience, is to be kind. That I have found that typically, and you stick with feelings, you just say, you know what, this actually just doesn't feel good to me, because they can't tell you your feelings are wrong.
Yes.
They're yours. You just say, this isn't feeling quite right to me. Thank you so much for the care you've provided. This just isn't feeling right. And
Yeah.
but I always, if somebody is saying, oh, you're wrong on fluoride, you can say, you know what, thank you for your opinion. I appreciate that. My opinion is very strong as well, and I feel like this is what's best for me and my family right now.
Yeah. That's what I've
Yeah,
always done. I'm just
And
like,
it's
okay.
it's the best way to be. You know what I mean? It's There's no reason to get in an argument or
No,
try to, because
totally.
honestly,
no,
you're talking with somebody who's not educated.
Yeah. And that's
You
right.
may
okay,
be more
right?
educated than they are in what you're discussing, and that's part of why they get so defensive. I've done
Yeah.
this before in the past. I see my old self. People would come in and say, "Why are my teeth worn off in the front?" I didn't know the answer, so I'd say, "Oh, I don't know. Let's just like smooth them out, now I know the answer, and so I can express that. But so many people, and as professionals, we don't know the answers, so we're
Mm,
gonna
Yeah.
get real defensive. You're wrong. You're wrong. You're just crazy.
No,
yeah.
no.
You're not
Look at
wrong.
the planet. The planet is in a mess because everybody just doing that.
Yep.
You're wrong, you're right. That's what it causes wars.
Mhm.
I'm not into that. I'm more of the different, it's a place to go that way, but not there. And especially with somebody that, you know, is trying to do something good. They just don't have the information.
Exactly. Yep.
That's all. But, we got to respect the fact that dentistry, it's really tough because people come in there scared and not liking it. And so it's an energetic thing. Growing up with shamans, I know that one. I mean, that energy of like, dislike against, it gets somewhere. It's like removing mercury. It gets somewhere,
Hmm.
you know
Yep.
and you guys take a lot of that, and it's really tough, the same with vets. People don't bring an animal to the vet to prevent. Nobody prevents. They get there with a problem and they want you to be the Merlin.
Fix
Yeah,
everything. Yep.
right. But it's a lot of responsibility dumped on you that they didn't take.
Yep.
So let's get them to take responsibility with the knowledge that you have. Where in your site you have referrals and it's books they can read, and people wants it to be done for them for some reason.
Yeah. Make it
But
easy,
we got
right?
it.
And that's what I'm trying to do, is make it easy. Trying to give you the information that you need to do exactly what you've said, to prevent disease, to stay well before we get sick. Our new pet company is called Longer Together because it's all about prevention. How do we
Oh,
prevent
longer
disease?
together
Yep. How do we
because they
prevent disease?
die out of the teeth is the biggest
Yep.
killer for the dogs. And
Yep.
in the crap that they put in their food, we
Yep.
make their food every day and it's balanced. One eats one thing, the other one other, because their system was not. And I have a friend of mine that you will see that in Soma Dogs, that it used to be the president of the Chopra Center. That's how I met her. So I teach for Deepak. And, she realized that the different kinds of dogs, and either kapha, pitta, where,
Yeah. Ayurvedic. Yeah.
yeah, and she was here teaching us, and I realized the kind of what my dogs weren't.
Interesting.
And that my husband is a kapha, and he chills out and walks away because that's a kapha person. That's what they
Uh-huh.
do,
Uh-huh. Yep.
So understanding how things work.
Yep. Yep.
And I always tell them, just think, you love your car, do you change the oil, you do all the maintenance before you are calling AAA.
Mm-hmm.
Okay, so it's the same with the body, and yeah, we connect it because I learned too from child that gums have issue connection with heart
Mm-hmm.
and
Huge connection with heart. Yep.
right. And I was having a lot of stuff with the heart. I mean, I survived what I survived, and I gotta say that next week I'm 78.
Wow.
Oh,
Amazing.
So you know what I mean? It's like
Yep.
you need
Working.
to take care of your machine.
mm-hmm.
Take
100%.
care of this.
Yep. Love
Don't
it.
expect it to just happen and be in the pollution that we are with all the spraying, whatever it is. Because if I go there, I kind of, my nervous system get up. But I do a lot of resetting on vagus nerve before I go to bed. So that helps me not to clinch.
Yep.
And I realize in a day I do check-ins.
Hmm.
Where are you?
Love it.
Are you tidying? Are
Uh-huh.
you
What are you doing? Uh-huh.
Yeah, do a checkup in the day. That's mindfulness, right?
Mm-hmm.
Don't eat so fast that you probably swallow a molar and you don't know it.
I hope not. Yes, exactly right.
I've seen that happen actually with a cat. People,
Yes.
because
Oh, right.
Yep. Then it just comes
they
off and there it
eat
goes.
like, psh. I am so, so honored because it's so important to care, and you did.
You did.
And I always talk to Divine and I say, the next life, let's watch this in a video or something. I don't need to get cancer. I don't need to get sick like you did to
Exactly.
get what I needed to do
Yeah.
in this lifetime.
We've already learned that. Let's do another thing next.
Yeah,
Next
Let's
yeah,
time.
let's use something nicer.
yeah, exactly.
Because if I'm here to help and be in service for divine, let's just do it in a different way. So I don't have to go through all that again and all that fear and are you gonna die in 15 days? I was like, no, I'm not. No,
There's a
I'm
different
not.
plan.
And I went to the beach and I sat there in Coconut Grove in Miami. I was kind of like in a daze. I was like, what just happened? It was the second clinic, Mayo Clinic said that. And so I went on the beach and I went, you sent me here to do something. And I have been doing it really well. I'm a single parent. I have a mother that lost a man, and I said, you're going to move that date. And that's when I found that date. I found Dr. Mishokushi. And
Wow.
he said, I'll pay for it. You're going to make it. And
Wow.
Luis Hay was there too. And we became really good friends. But thank you. Thank you because the light workers are coming together. Thank God in the new world. And you sacrificed yourself and took chances in a country that is really heavy duty on the medical, they have their thing going on and their pharmaca going on and being a woman.
Yep.
But you did it and you took it. And I hope you give yourself that credit because thanks to you, you're saving lives.
Thank you. That's beautiful. I
Yeah.
appreciate
You
you
so
both.
much. Yeah, thank you so much for being here and sharing all the wisdom that you shared. I learned so much today. So I'm
Great.
sure everybody else that was watching and listening is going to learn so much. I
Yeah.
appreciate it. We'll make sure that we've got all of your links so that people can go
Perfect.
and buy those products and get what they need as a preventative. And yeah,
Great.
just thank you again.
Okay. Thank you
Thank you
both.
so much, Dr.
Great day.
Thank you. Thank you,
Bye.
Dr. Michelle.
Bye.